I'm Becky Malby. I'm the Director of the Centre for Innovation in Health Management, and I'm also a Director of the think tank for the Northern Leadership Academy. I'm going to talk about what yesterday meant for me, but it's linked to the problem or the context about why we've even had yesterday's conversation, which is that there are a number of chief executives that I work with who are working with a performance management framework that they don't think is fit for purpose. In fact, it's so out of kilt with the way they're operating and behaving, i.e. the things they know about what works in their own health system, that they're finding that it's creating a lot of dysfunctionality in the public sector. And that seems to resonate across both health systems and local authority systems, that some of the ways of measuring or looking at what counts is really unproductive. So we've been looking at ways of developing feedback loops and performance management systems that might be more in tune with how people really do their work. And that's partly because the way we tell stories about what we do is sometimes cleaned up in order to look good for external viewers. But if you get into how we really run organisations and what we really pay attention to, those could be quite different things. And what struck me yesterday was that I suppose I'd already assumed that if you are looking at a particular aspect of performance, like patient's experience, because you think that matters, that you can get feedback that helps you have a conversation in the organisation about what do we do differently. But we're working in a climate where there is something called a truth about the best. And what's been resonating in my mind for some time and really struck me yesterday was A, that truth doesn't exist, it's all contextual. B, we're not really sure what better is anyway, or even what's possible. It's always a sort of moving feast. And I liked the notion about performance management being an experiment. It's an experiment in what's possible, and the performance metrics are a way of helping understand both what is and what could be. And that's going to be really hard for us to sell back to both CEs and to the departments and to politicians, say this is a persistently moving feast. So there was a real puzzle there for me. And the second bit that struck me, which it feels very comfortable, but I think is again very counterintuitive in the current public sector, which is that you need a lot of variability. That variability in the system is very healthy, and it's from variability you learn, whereas what we see everywhere is a need for standardisation. So you see patients or users, or those of us that use council services, wanting the same thing. We want the best thing for us. And there's something about if you're going to have innovation and change, you're always going to have some variability in the system. People are always going to be a bit better and some people are catching up. Or that you might want to be testing various states all the time. And it's how do we run a public service with variability and an expectation around standardisation. And I don't know where we're going to get with that today.